Pericarditis. Introduction. Pericarditis is the inflammation of the pericardium, the thin, double-walled sac surrounding the heart. The pericardium serves to protect and lubricate the heart, preventing friction during heartbeats. Inflammation of the sac can lead to chest pain and may cause fluid accumulation, pericardial effusion, impairing the heart's function. Pericarditis may be acute, lasting less than 6 weeks, subacute, or chronic, persisting for more than 3 months. Definition. Pericarditis is inflammation of the pericardium, commonly presenting with chest pain and pericardial friction rub. Pericarditis is defined as inflammation of the pericardial layers, often accompanied by pericardial effusion and chest pain. Risk factors. Viral infections, example Coxsackie virus, influenza. Bacterial infections, example tuberculosis. Autoimmune diseases, example lupus, rheumatoid arthritis. Post-myocardial infarction, Dressler's syndrome. Trauma or chest injury. Kidney failure, uremic pericarditis. Cancer, malignancy-related pericarditis. Medications, example hydralazine, isoniazid, phenytoin. Radiation therapy to the chest. Etiology. 1. Infectious causes. Viral, Coxsackie virus, echovirus, HIV, influenza. Bacterial, tuberculosis, streptococcus, staphylococcus. Fungal, histoplasmosis, aspergillus, rare. 2. Non-infectious causes. Autoimmune conditions, systemic lupus erythematosus, SLE, rheumatoid arthritis. Post-cardiac injury, post-ME, Dressler's syndrome, post-cardiac surgery. Metabolic, uremia due to kidney failure. Malignancy, lung and breast cancer metastasis. Drugs, procainamide, hydralazine, isoniazid. Classification. Acute pericarditis, duration, less than 6 weeks. Acute pericarditis is a sudden inflammation of the pericardium that lasts for less than 6 weeks. It usually presents with sharp chest pain that worsens with deep breathing or lying down and is often caused by viral infections, myocardial infarction, or autoimmune conditions. Subacute pericarditis, duration, 6 weeks to 6 months. Subacute pericarditis develops over a period of 6 weeks to 6 months. It may follow unresolved acute pericarditis, presenting with prolonged chest discomfort, fatigue, and may require extended treatment with anti-inflammatory medications. Chronic pericarditis, duration, more than 6 months. Chronic pericarditis lasts for more than 6 months and can cause permanent thickening or scarring of the pericardium. It may lead to ongoing chest pain and signs of heart dysfunction and often requires long-term therapy and monitoring. Constrictive pericarditis, chronic condition, develops over months to years. Constrictive pericarditis is a long-term condition where the pericardium becomes thickened and fibrotic, restricting the heart's ability to pump efficiently. Symptoms include swelling, shortness of breath, and fatigue, often necessitating surgical intervention. Effusive pericarditis, duration, variable, depending on cause and severity. Effusive pericarditis involves the accumulation of fluid in the pericardial sac. If the fluid builds up rapidly or in large amounts, it can lead to cardiac tamponade, a life-threatening condition that requires urgent drainage of fluid and treatment of the underlying cause. Pathophysiology. Trigger, infection, autoimmune, trauma. Down arrow. Inflammation of pericardial layers. Down arrow. Increased permeability of pericardial capillaries. Down arrow. Exudation of fluid into pericardial space, pericardial effusion. Down arrow. Pericardial thickening and possible fibrosis, if chronic. Down arrow. Compression of heart chambers, tamponade if severe. Down arrow. Reduced cardiac output and hemodynamic compromise. Clinical manifestations. Sharp, pleuritic chest pain, worse on inspiration and lying down, relieved by sitting up. Pericardial friction rub, scratchy sound on auscultation. Dyspnea, shortness of breath. Fever, malaise, if infectious cause. Palpitations. Tachycardia. Signs of pericardial effusion, example muffled heart sounds, hypotension in tamponade. Diagnostic evaluation. Medical history and physical examination, chest pain characteristics, friction rub. Electrocardiogram, ECG ST segment elevation, diffuse, PR depression. Echocardiogram, detects pericardial effusion, cardiac tamponade. Chest X-ray, enlarged cardiac silhouette in large effusions. Cardiac MRI/CT, detailed imaging of pericardium. Blood tests. CBC, elevated WBC count. CRP and ESR, elevated in inflammation. Troponins, may be elevated if myocarditis coexists. Pericardial fluid analysis, if pericardiocentesis performed to detect infection, malignancy, or autoimmune markers. Medical management. Nonsteroidal anti-inflammatory drugs, NSAIDs, example ibuprofen, aspirin first line to reduce inflammation and pain. Colchicine, reduces recurrence and inflammation. Corticosteroids, example prednisone for autoimmune or refractory cases. Antibiotics, if bacterial infection confirmed, example for TB, anti-TB drugs. Antifungals, if fungal cause suspected. Diuretics, if signs of heart failure or large effusion present. Pericardiocentesis, removal of excess fluid if tamponade occurs. Surgical management. Pericardiectomy, surgical removal of pericardium in constrictive pericarditis. Pericardial window, to drain recurrent effusions. Nursing management. 1. Acute pain related to inflammation of the pericardium. Interventions. Assess pain characteristics, location, intensity, duration, and factors that relieve or aggravate it. Administer prescribed analgesics and anti-inflammatory medications, example NSAIDs, colchicine. Encourage the patient to sit upright or lean forward to reduce chest pain. Teach relaxation techniques such as deep breathing to help manage pain. Monitor for signs of worsening pain that may indicate complications, example cardiac tamponade. 2. Ineffective breathing pattern related to chest pain and anxiety. Interventions. Monitor respiratory rate, rhythm, and depth. Position the patient in a comfortable, upright position to ease breathing. Provide supplemental oxygen if prescribed and needed. Encourage slow, deep breathing exercises to improve ventilation and reduce anxiety. Educate the patient about the importance of avoiding strenuous activities that may worsen symptoms. 3. Risk for decreased cardiac output related to pericardial inflammation and possible effusion. Interventions. Monitor vital signs frequently, blood pressure, heart rate, respiratory rate, oxygen saturation. Assess for signs of cardiac tamponade, example muffled heart sounds, jugular venous distension, hypotension. Monitor for changes in heart sounds and pericardial friction rub. Ensure access is maintained for emergency medications or fluid resuscitation if needed. Prepare the patient for pericardiocentesis if indicated. 4. Anxiety related to chest pain, fear of complications, and hospitalization. Interventions. Provide emotional support and a calm environment to reduce anxiety. Educate the patient and family about pericarditis, treatment plan, and prognosis. Encourage the patient to verbalize feelings and concerns. Involve family members in care to promote comfort and reassurance. Use relaxation techniques such as guided imagery and breathing exercises. 5. Knowledge deficit related to lack of information about the disease process and self-care. Interventions. Educate the patient about the nature of pericarditis, possible causes, and treatment options. Instruct the patient on the importance of medication adherence, example anti-inflammatory drugs, antibiotics if infection is present. Teach signs and symptoms that should be reported immediately, example worsening chest pain, shortness of breath, fainting. Provide guidance on lifestyle modifications, including adequate rest and avoiding strenuous activities. Explain the need for follow-up appointments and monitoring. Complications. Pericardial effusion. Cardiac tamponade, life-threatening. Constrictive pericarditis. Chronic recurrent pericarditis. Heart failure, if severe compression. Prevention. Early treatment of infections, viral, bacterial. Avoiding known medications that may trigger pericarditis. Regular monitoring in autoimmune diseases. Managing chronic illnesses, example kidney disease, properly. Routine follow-up if history of pericarditis. Conclusion. Pericarditis is an inflammatory heart condition that, if recognized early, can be effectively treated with medical therapy. Nurses play a critical role in monitoring for complications like cardiac tamponade and in providing supportive care. Patient education about medication adherence, activity modification, and recognizing warning signs is essential to prevent recurrence and improve outcomes.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.